Today we're going to go over the best core stabilizing exercises for someone with scoliosis. And the reason we're picking these specific core exercises is because the muscles they target and focus. We look at scoliosis research. The muscles that are most affected in patients with scoliosis, specifically adults with degenerative scoliosis, are what's called your multifidus muscles. Now, your multifidus muscles are muscles that go all along your spinal column, and they're the most dense in your lower or lumbar spine. And these muscles really have three main functions. One, they allow your spine to laterally flex or bend. Two, they allow you to extend your spine, so posterior extension and erector muscle strength. And three, they allow for contralateral rotation. So we're gonna go over three core stabilizing exercises that target and focus on these specific functions. And then at the end of the video, I'm gonna give you two exercises that are gonna be really effective in increasing muscle strength, or what's called muscle hypertrophy, which is muscle size for multifidus muscles. The first one I'm gonna show you is a side plank. And there's three different ways I'm gonna show you to do this. And the reason we're gonna do this on a side plank, it's actually gonna work on the muscles on the lower side. So you can do this on your elbow. I'm gonna have my legs straight, and I'm gonna just raise my body up, and I wanna keep this in a V, a straight line. Now, it's good to start this at 30 seconds, and when I'm doing this, it's actually working the muscles here on my lower side, or the side towards the ground. You're gonna wanna do this on both sides. Now, another variation, a bit more advanced, is I can put my hands straight, my legs straight, and now I can hold my body in a straight line. This is a little bit more challenging because now my body is a little bit more unstable, so I have to work a bit more to stabilize. And then if I want to make this a little bit more aggressive, I can actually add in some things like leg raises while I lay on my side, or I could hold a weight and I could do those too. So these are great to start off at 30 seconds, and then you can build up to 60 seconds or 90 seconds. But you want to make sure you do both sides. So my recommendation is to do 2 sets of 30 seconds each side. And those are going to work on the muscles, the multifidus muscles that specifically work on lateral bending, but they also work on some stabilization with the contralateral rotation. One of the exercises, or one of the movements I talked about, was lumbar extension. So a great exercise to work on that are pelvic bridges. I'm going to show you 3 variations. The simplest is just to lay on the ground, your feet square and flat. You're gonna lift your pelvis, and you're just gonna hold that, and you're gonna repeat these. And I would do these at a higher number, probably more like 15 to like 20 repetitions. Pause for a few seconds at the end. Now, to make this a little bit more challenging, you can do these on single leg. And these are working on the lumbar extension, but they're also working on the contralateral rotation. So you're gonna have one leg down, one leg up. Lift your pelvis up and down. Again, you do these at a higher number, probably between 15 and 20. And then you're gonna wanna do both sides as well. And then one more variation, you can put your feet on one of these BOSU balls, and you're gonna do the same thing, pelvic bridge, legs straight, lift your hips up and down. And this just makes it a little bit more unstable. So your muscles have to work a little bit harder to work on stabilizing your spine while you're working on the lumbar extension. And the third great stabilizing muscle are simple bird dog exercises. And these are great because they work on the extension, which is one of the functions. And they're also going to make you stabilize and work on contralateral rotation. So to do the bird dogs, you're going to start with your hands and knees on the ground. And if you're really, if you're a beginner and you don't have a lot of muscle strength or endurance, you may start off by doing simple one leg extensions or one arm extensions, but you want to get to the point where you're doing opposite arm, opposite leg, holding that for a couple seconds, and then switching and rotating. And I like to do each side 5 times, and I would do 2 to 3 sets of 5. And those are working on that contralateral rotation, but also the thoracic extension. Now, the 2 best exercises to work on pure muscle strength and muscle hypertrophy for the multifidus muscles are going to be doing things like squats and deadlifts. Now, if you're watching this, you probably have scoliosis, and we don't want to put a bunch of load or weight on our spines with scoliosis, so I'm going to show you a couple ways to do these that are not putting a lot of excessive loading on your spine. One of the best ways to do a deadlift without excessive loads is to use a resistance band. And there's different sizes and strengths, so you can adjust accordingly. You're going to take this, I'm just going to step on the band, I'm going to grab each side, I'm going to have my spine in a nice straight. I'm not going to be hunched over. My spine's in a nice good position. I'm just going to stand up like this and go down. Good. And doing this anywhere, when you're doing deadlifts, 5 to 7 reps is excellent. And I would do at least 3 sets. And to increase resistance, you just use a thicker band or more than one band. Now, to avoid doing heavy back squats, because we don't want to compress the spine excessively if we have degenerative scoliosis, we can do those with a dumbbell, or a great thing to use is a kettlebell. And so you're going to have a nice base in your feet, you're going to have your hands gripped, and you're just going to do a nice deep squat. And that's working all your erector muscles while you're doing a squat. And because we're doing it with a kettlebell versus a barbell with a bunch of weight, we're minimizing the amount of compression on our spine. So those are 3 great stabilizing exercises and 2 great functional exercises that increase multifidus, strength, and stability. Now, if you're finding this information helpful, be sure you hit the subscribe button below and hit that bell icon so you're notified whenever we release new content on how to treat scoliosis at home.